she's going to, she's going to either die or she's going to live. There was not any choice.
Well, imagine having no history of heart problems, but then you find yourself facing the hard reality your heart is failing you. Well, that's a scary diagnosis that Wynn Pearson received back in August. And Queen City News reporter Daniel Pearson tonight joins us here in the studio. And Daniel, she not only survived a rare set of circumstances, but she did it at a place that she volunteered for decades.
Yeah, Alicia, Wynn Pearson walked through the front doors of the Novant Health Cancer and Cardiovascular Center in Midtown just about every week for 2 decades. She would help patients on their hardest days. As her doctor explained to me, she got back exactly what she put into the world.
It's a type of conversation Wynn Pearson isn't used to having.
How are you feeling?
Not bad at all, actually.
Being asked how she's feeling. In a place she spent years easing patients when they didn't have a positive answer to the same question.
To go and talk to patients, and if they needed someone to talk to, I was there.
She spent 22 years volunteering at Novant Health in Midtown Charlotte, not once thinking she'd be a patient herself for a disease never on her radar.
It was happening like almost to somebody else. And I went through, the different phases, and I realized, God, I've been so lucky.
Late August, Wynn began to experience shortness of breath. It got so severe when she showed up at the emergency room in Huntersville, they sent her directly here to Novant Health's Belk Heart and Vascular Institute in Charlotte.
I thought she was not going to survive the night.
Wynn needed a new heart valve, a type of intense procedure which typically takes a few weeks to plan.
She's probably not going to make it much longer. The only thing to do is a Hail Mary to try to replace this heart valve this quickly, which never been done before.
When she was hospitalized, she was already on borrowed time.
Because as soon as they put her to sleep, she was going to die.
So Dr. Daniel Pugh and his team made that Hail Mary.
Crossing it out.
They just had to get in there and do it.
Not only was the procedure a success, but when she came to, Wynn found herself surrounded by a few familiar faces.
When I volunteered, and some of the nurses.
I don't know if people believe in karma, but sometimes that's how it works. She was a volunteer here, and the stars aligned.
Wynn's not just thankful for what she got out of the world, but continues her crusade to pay it forward for the next person in crisis.
Perfect peace about what was going to happen to me. And I think a lot of people could use that encouragement.
Perfect peace. Pearson's story has captivated so many. I was told that she has been chosen to be an ambassador and share her story with other people in the medical field about the success of this type of equipment and this style of treatment.
And we thank her for sharing her story with you, Daniel.